Kenya's Ministry of Health has been at the forefront of efforts to enhance domestic health financing, a critical step toward achieving sustainable and equitable healthcare systems. Through its collaboration with the African Institute for Development Policy, AFIDEP, and Partners in Population for Development Africa Regional Office, PPD-ARO, under the Advanced Domestic Health Financing ADHF project, the ministry has tapped into the project's expertise in evidence generation and policy advocacy. This partnership aims to optimize resource allocation and efficiency in the use of available resources while embedding evidence-informed approaches in health sector decision-making. In this brief conversation with Dr. Elizabeth Wangia, Director of Health Financing at the Health Ministry, we delve into the nature of this partnership and the changes the ministry has observed as a result of working with the ADHF project. Welcome, Dr. Wangia. AFIDEP and PPD-ARO, through the ADHF project, are working with the Ministry of Health to realize domestic health financing. How would you describe this partnership?
Yes, the Ministry of Health, through the Directorate for Health Financing, has worked closely with AFIDEP because our goals are aligned. I would want to say so. We have a goal. We have committed through as a commitment from the African Leadership Meeting in 2019 that we will increase our domestic resources. And therefore, this is one area in which we have been working with them, looking at what interventions can be put in place to improve these domestic resources, what areas, how can we advocate better for these resources. And generally, as I also mentioned about data-driven decision-making, how can we use evidence to to inform our investments? Because for you to advocate for resources, you need to also have some evidence in terms of, like a return on investments or, the value for money. And therefore, these are some areas in which we are working together with AFIDEP through a process of co-creation that we undertook to see how we can, have an impact in this aspect.
Are there changes that the ministry has noted as a result of working with the ADHF project, especially on the use of evidence in key decision making?
Yeah, I would say we have worked closely with AFIDEP in generating evidence. When we had our national dialogue last year, quite a significant amount of, I would say significant number of knowledge products were shared and generated, and some of them actually were used to even make decisions around I would say the roadmap or the communique that was developed at the end of the national dialogue. A lot can be, of course, more collaboration would be really key. In the next year, what we are really prioritizing is working together with them so that as this evidence is being generated, they can handhold or mentor some of our teams, so that as we prepare all this evidence together, we actually have a team who will be able to stand alone on their own and also do this knowledge product, because we know that this skill set is strong within AFIDEP, but on our end as the ministry, it's not a very strong skill. And therefore, we are really looking forward to that interaction in the next 12 months to see how can we mentor some of our young people or even the older ones to have that interest in evidence generation.